So many of the problems we see when we're dealing with veterinary patients are because they are cats, because it's a feline patient, compromising their normal behaviour in some way. So looking at how a cat would like to view the world, what it would do in order to stand back, assess, patrol, and then look at what we do and how we force interaction on them in a relatively confined space of time. Cats like to take their time. They love to watch, observe, make their decision. We know that from the way they interact with their natural environment. And then we want to do that in a compressed period of time. We've got to do it against the clock. So giving them time just to observe and watch is actually quite difficult. It's one of the things I think we see with children as well, isn't it? When they're young and they're particularly toddlers, one of the biggest things I found when I was raising my two children is that the worst time is when you're busy, is when you're time pressured. Because actually, if you can do things at their speed, that you don't get that confrontation, but they want to, you walk into the shops, they would take 4 hours to do it because they want to stop and look at every road sign or look at every flower or observe something happening. But the problem is we're living on a different time scale as adults. We've got to do it quickly, and that's often the same with cats. They live in that dawdle world. They like that toddler approach of, but I want to take everything in and check everything before, because they have to look after their survival. That natural, solitary survivor thing means observing the environment's really important. You don't want to miss anything that could potentially be difficult. But to do that, it takes time. So when you come out of your cat basket into the consult room, I need time to make sure I've seen everything, clocked everything, realised everything's okay. And we're trying to have done the examination, had them back in the basket before they've got time to even look around the room. And then we wonder why they get worried about it. So we're just looking at it from a completely different perspective. So their basic social behaviour, avoidance is their preferred reaction to protective emotion. If they're worried about something, they think they're going to be compromised, they want to get away from it. That's their primary, and they want to get away from it, not it go away from them. And that's to do with delegation. So if you think about the strategies of avoidance and inhibition and repulsion and appeasement, when you repel something, and this is a bit of a misperception about repulsion and avoidance, when you repel something, you actually delegate. You don't have control if you're using repulsion, because you do something, but the other has to take the action in response to that. When you're using avoidance, you're actually in control. And that the opposite is perceived. People think the one who's confrontational and repelling is the more confident one and the one that's taking control. It's actually the absolute opposite. So if I was in a pub, and in those good old days, and I was feeling a bit like someone was sitting too close to me. So I'm sitting at a table before COVID, someone comes and sits right next to me and I'm feeling a bit uncomfortable. I can try repulsion, and I'd start with low intensity, because you always gradate up through your behavioural responses from the lowest intensity to the highest, depending on when you're successful. And I can go, would you mind just moving away a little bit, please? Feel a bit uncomfortable. I've got no control over whether that actually happens. It's whether they move or not. So they don't move, I can escalate, I can try using more intense repulsion, so I can get more rude, and I can get to the point of poking them, prodding them, slapping them. I still can't actually have control over whether they move. The only way I can resolve my problem is to move to another table myself. Then I'm in control. Does that make sense? Yeah. So for cats, avoidance is much better than repulsion. And when I ask the vet students this when I'm teaching them, and ask them to tell me, out of avoidance and repulsion, which is a cat more likely to use, they'll often say repulsion. And it's often because that's what they've seen in the veterinary practice. And you say, okay, let's think about it from an ethological point of view. Actually, it's avoidance, isn't it? So why do you see so much repulsion in cats in a veterinary practice? Because they can't use avoidance. they have no perception of being able to move to the other table, we've taken that away from them, then we're much more likely to use repulsion.